Okay. Well, welcome back.
Thank you.
And so the first time you came in was to sort of we introduced you, and so there are a lot of people waiting for this update. Since about what 4 weeks ago.
Yeah.
Okay. So lots of has happened since
Yes.
then.
Yes. I
Yeah.
think so. Yes.
So you've had doctor's appointments.
Yes. And tests.
You've had testing.
Mm-hmm.
The biopsy, you had your lungs. They tried to go in for a biopsy.
They did.
And then what happened?
Well, what has happened in the month is that I talked the first episode or whatever these are called about having fluid drained, and I've continued to have that done every about 6 or 7 days. It becomes very uncomfortable. And then they would biopsy or attempt to biopsy the fluid, but they could never find any cancer cells, which was not unusual. It didn't mean, well, there's no cancer there. It meant that they're floating around in all this fluid and they just can't capture them. So they just continue to do that as I have those procedures done. And I've had about 5 of them, I think. And they're not bad, uncomfortable. I get very uncomfortable before I have the procedure, and I wish I could have them more often. That will change.
Drain the fluid.
To drain the fluid. And then they did a biopsy of my lungs because there were nodules in my lungs. They had to do that with the CT. And they did not they found unusual cells, but they did not believe they were cancer cells.
Okay.
So then they had to, girls.
Speaking of the girls, by the way, this is Jill. Jill is Liz's daughter, and Deb also Liz's daughter. And they're joining us today to sort of give us insight as to how they've dealt with this.
Mm-hmm.
And, Jill, you're visiting until
Tuesday.
Mm-hmm. And then you're coming back.
I'll be back quite frequently.
Okay.
Yeah, maybe once a month.
Okay. And Deb lives here and
she's here. Yeah.
Is here always.
Helping.
So.
Yeah.
But
so I looked at them. I just since the time I've had an MRI, we met with the doctor after about 2 weeks. And in the meantime, I have to mention this, South Carolina had snow. And for those of you in the Northwest that are watching this, these people are wieners. So nothing happened. And we had 2 inches of snow.
I'm a wiener.
Yeah, she is.
Hi.
So that really held up test results and getting a hold of the doctor and stuff like that. So anyway, met with the doctor. He couldn't conclusively tell me that for sure I had pancreatic cancer, although he believed that I did. The pancreas looked like that's what it was on the first CT, but he needed something in writing that said these cells were found and they are pancreatic and what kind of cancer it is. Then we started, and then I had to have an MRI. And then I had to go into Savannah to a GI doctor, and they did an endoscopy with a biopsy and ultrasound, and they actually took tissue out of my pancreas. And they had an ultrasound to look at my pancreas. And they found the specimen was definitely pancreatic cancer. He could see that it was pancreatic cancer. And so that's where we are right now. We met with the doctor last week, the girls and I. And
how did you take that? It was actually definite. For sure.
Well, I think the biggest thing is they didn't know how to until they had those for sure. There could be no treatment plan because you can't have a treatment plan if you don't know really what you're treating. I don't think they really ever doubted that it was pancreatic cancer, but they needed to know, okay, what are we going to do about it? And to know what we're going to do about it.
He couldn't write an order for hospice.
Or chemo or anything.
We were just to stay on.
There was no plan because they were not.
And that was frustrating for me because I believe that I have it.
Sure.
I was just sure that's what it was. And the first time I met with him, I have 6 months to live if I don't treat it. And now I'm at, the month. Now we're a month later. Do I have 5 months to live? Or do I get to start over? And, so that's frustrating.
Sure.
Yeah.
Because he said 6 months yesterday.
Yes, he did say
And I
that
said,
again.
that's what you said a month ago.
Right.
But I
But
think
it's
time,
all-
I think time is
It's
so
relative, right?
right,
It's
totally
relative,
relative.
yeah.
And I think it's important to know that, I read some research that they're really starting to lean towards not telling people timelines because when you are told you have 6 months to live and you
Right.
make that decision, guess what? You're probably going to live 6 months or less.
Yeah, you're
Because
gonna
I
look at the
believe,
calendar,
again,
yeah.
you know how I believe, mind over matter. And
Totally.
you can manifest
100%.
that.
Absolutely.
If you tell yourself, okay, I've got 6 months. Well,
Here's the date.
Yeah.
and then you're going, okay, well, that's, February, March, April, May, June,
Mhm.
July, August. And then August, all of a sudden, you're like,
Waiting.
Yeah.
Yeah, I
and so
think
you
that-
put yourself in a stressful state, which is not ever good. And
That's
then
right.
it speeds up anything that might have not been sped up.
Yes, so we met with the doctor yesterday. And he had conclusive evidence that that's what I had. So he said, you have 3 options. You can
And it's adenocarcinoma, just so people know.
Yeah,
Adenocarcinoma.
we were saying it
or
wrong.
adeno.
Adenocarcinoma, which I think I talked about in the first podcast. There were 2 different types, so I've got the bad one. And I had 3 options. I can do a chemo regimen that he called the nuclear bomb.
Mhm.
And
Mhm.
just
That sounds
I know. He said it's
awful.
heavy duty stuff. And he explained more about that, but you get the gist.
Mhm.
Or a second option was just like maybe a little baby bomb.
More
And
moderate, like a more
moderate.
moderate.
He didn't refer to that one as a bomb.
No,
No, he
he
didn't.
just called it more a moderate chemotherapy.
Moderate, yeah. Okay, thank you, girls. And then the third option is to do nothing. And I, in my mind, really believed that I would say do nothing. Because
I never believed she would say that, just FYI. I think she would
did
be
you
in
believe
tough.
I would say that? You were hoping I wouldn't say that.
Well, I think that
I-
the fact is that you're really, really strong. So
Yeah, I
you are
gotta-
a fighter.
I kind of want to see if I can stand it. I mean,
Of course you can. You're Liz.
I know, but he said, the first I'll have 2 weeks. I'll have right, girls.
2
I'll have
weeks
chemo
on, 1 week off.
2 weeks on, 1 week off.
Like 3-week cycles.
And I said, and for how long will I do that? And he said, indefinitely.
Indefinitely.
So
As long as you want to.
as long as I want to.
Okay. Here's a question.
Okay.
There is a tumor
Correct.
on your pancreas
Correct.
that is cancerous.
In
Correct.
the pancreas.
It's
Inside.
in it.
Mhm.
Okay. That's and can they do exploratory surgery if it shrinks down to a certain size, which obviously will not cure the cancer, but will put more years on your life?
Oh, I'm sorry.
And I did ask that question, did I not?
Mhm.
I don't remember the answer.
I do. So the answer is a surgery if the tumor reduces, and it would make her an option to be a surgical candidate for the Whipple procedure, which is basically rerouting things that
The
are
bile
needed.
duct.
What your mom got.
Yes.
Correct.
Exactly.
But it has a very high mortality rate, the surgery alone, and oftentimes, in fact, my mom said, well, my mom was in ICU for 2 weeks after the surgery, and he said, well, she's a rock star if she was only there for 2 weeks. He
Right. He did
talked
say
about
that. Yeah.
a 50-year-old patient that he just had that was in for like 2.5 months.
And he was like a runner, like a
athlete.
athlete.
Athlete,
Yeah.
How old was he?
like 50.
50.
Mhm.
Oof.
Yeah.
So I think the biggest thing is yes, it could very well shrink,
it could.
but could she survive that surgery if her immune system's so deregulated from those
From the chemo.
chemo?
And they'll do a CT after every 1, 2, 3.
Uh-huh.
Is that what he said? I couldn't remember.
Yeah,
Was he
he
saying
did.
every time? Okay.
Yeah.
Yeah, to see if it's working.
Right.
Okay.
If anything's
Because if
happening.
it's
Okay,
not
that makes sense,
working,
Why should you
Then-
be sick?
Yeah. So anyway, bottom line, folks, I chose to try it.
Moderate. The moderate
Moderate,
one, not the bomb.
Not
The moderate.
No bombs.
No bombs.
No bomb.
We don't like that word.
Because they did say with that bomb choice, the problem is that it's such a bomb that she could literally be put in the hospital because she's so sick.
Oh no.
Mhm.
Yeah.
Yeah.
And when would you start that? Like, let's just say you chose the big
The
one.
bomb.
Yeah. When would you start that?
Now.
Now.
Probably the same as the moderate.
as the
yeah.
moderate.
So create, like, I mean,
Yeah.
You're able.
you don't feel great now, but
I don't feel great.
But she has really.
I have good
I just
times.
want everybody to know that since I've been here, I've been here a week
Yeah.
today, actually a week today, right?
Oh, that's right. Saturday
Saturday.
night. Yeah, that's right.
We have been on golf cart rides
We have.
and out to dinner, and we sat and had afternoon cocktails and
The ale house.
at
yeah.
the ale house.
Yeah.
do you
Um,
find that you get tired quicker?
I get tired and I feel that like I got up one morning and sat at my desk and mornings are good for me. But just all this sudden, this just wave of fatigue, which I don't even understand fatigue really, but I felt it. Where I was just so tired, I needed to go lay down. That's weird. That's unusual for me. I'm not a day napper, never have been. The girls are loving it because they're day nappers. So if I take,
I'm not a day napper.
I am totally.
Oh,
Jill's a
a
day
day
napper.
totally. So
I've
when I
kind of
say,
become one.
I should live in Europe where we have siestas.
But I love it when I can go to mom's because I'm like, I get to lay on her bed and nobody's going to bother me.
Yeah.
I'm just going to lay on her
And you're
bed.
just gonna be supportive.
Yeah.
So I'm like, don't we need a nap?
Yeah, let's lay down and take a nap.
Yeah.
I'll rub your back.
Yesterday, I couldn't even just get her to take a nap. I was like,
no, I
good Lord, woman, we've been at the doctor and we went to breakfast. The three of us went to breakfast and then we went and got gas.
Is it because you weren't tired or you were just you just don't want to waste time sleeping?
Well, that does occur to me.
Yes.
Yeah, that does occur to me.
Sure.
I think yesterday I ate. I mean, Jill's been here and observing me daily, 24/7,
Sure.
and it makes a difference. If I eat, I have no appetite.
You've always been a foodie.
I'm a foodie. Yeah.
Well,
I love food too.
Oh, I love food.
yeah, but when I think of a foodie, I think of like you like to try adventurous new foods
Oh,
and
no,
fancy
no,
restaurants.
No, I'm
No,
a
no.
very provincial eater,
You
but I
live
eat what I
live
like.
to eat and
Yes.
not eat to live.
I-
Okay, we'll take the
absolutely.
IE off of it and we love food.
Yeah.
We love
There you
food.
We're,
Yeah.
She
Love
loves some
food.
bread.
We
the bread.
She loves some bread.
I'll take my
Donna.
bread.
bread and butter. Oh my
I couldn't be
gosh.
on a carb-free diet.
Mhm.
Yeah.
Don't play with my food
And
and my bread.
and bread and butter, I digest well. I'm apparently having some digestion issues. Yeah.
How often do you feel like the distinction comes? Like you get drained, and then how soon after you get drained are you filling up back up again?
Probably on the fourth day,
I
I
was gonna
start
say the
kind of feeling it a little.
Sure.
Are you feeling it yet?
No.
You said last night you were.
Oh, did I?
I called the doctor.
Forgot.
Yeah.
Oh,
I don't know if that's cancer or just old age. I
Did
do
you-
forget things. Yeah.
Did you guys, when you were at the appointment, did you make an appointment for this week?
No, we
No, we
forgot.
forgot.
So when she started feeling that, I
Oh.
called the oncology and I
Yeah.
talked to the nurse practitioner about 6:30 last night.
Okay.
And we made a plan for if the fluid fills up because she did confirm that there is no on-call intervention radiologist
Yeah,
on the
we've
weekends.
tried to
Yeah,
do
that's
that.
just, yeah,
just
same thing.
absolutely.
And you
fine.
forgot to mention you're going to get a drain
Yes, and that's big.
attached.
That's big. If I go get drained next week, early week, that'll be my last one because they're gonna put actually the drain in the side of me.
Okay.
So
we
Will
get
she
to-
drain it herself?
I think of
Are
it
you
as
like
a
a case?
faucet.
scared about that?
I'm gonna.
You're
be
actually
happy.
looking forward
We're
to
gonna,
it.
we're gonna tap her. We're gonna be like,
Yeah.
oh, she's ready to be tapped.
Yeah, just go over there and
Yep, exactly.
I said to the
He said-
doctor, so
oh,
I
yeah.
could just walk over to the sink and just. And he said, "Well,
How about the
probably not
toilet?"
the sink." But so
Yeah.
yeah,
They
that'll be
probably
a
will
relief.
want us to measure it, wouldn't you think?
Yeah,
So they know how much
CC's
fluid
out.
she's
Yeah,
getting,
for
how
sure.
much.
Yeah.
Well,
I
there's
do.
probably, I would think that
Not bad.
Uh,
No
there's
bad.
probably,
No, he said it was literally just a drain, like we'll just
like
we
a-
can have a little cup made. It's like mom's drain cup,
Oh my
Ooh,
God.
fun.
like an engraved measuring cup.
Oh my God.
Or my wine glass that says beauty.
Oh, I'll take a Sharpie and put 2 ounces or
Yeah,
like
there
the
you go.
liter levels.
Liters. We've got to
Oh, see, I was thinking it was going to be like the tummy tuck thing where you
Uh-huh.
have a bag attached
No, I don't think
and
so.
it's got like,
I know what you're
No, because
talking
that's got that suction ball to pull the fluid out.
Oh,
Oh,
my
good
God.
grief.
I think she's just
Yeah.
gonna be like, I'm a little teapot. Just tip
That would
me
be good.
over and
Well, we could
Pour
include
me
that
out.
on the next podcast. I guess I'll have it by then. Yeah,
oh my God.
I'm
I
happy
didn't know
about
that.
Because
Is
then
it
I
gonna
can-
is it gonna have like
yeah.
a thing?
Oh
you
my
go-
God, Debbie, I envisioned a faucet, but I don't think so.
everybody Google it. You can find
Yeah.
Yeah,
a
well,
Side's
know
drain,
how
right?
we're
A
gonna
Side's
do
drain.
this. No. I think it's great that they're gonna do that.
Yeah, that's awesome. I love that for
Yeah. Because but if you do any reading on this stuff that is originally I was told it was the liver leaking. Now get a visual on that.
Mm-hmm.
But then the GI guy said, no, that's your pancreas. There's something leaking in the bile ducts.
But then the radiology guy that emptied it, when you said the GI doctor said it was my pancreas leaking, but the oncologist said it was your liver leaking, and the radiologist guy said, well, I tend to agree that it's your liver that's leaking and not your pancreas. So
So
But
they don't know for
something's
sure what's
leaking.
leaking.
it's all, yeah, and he said like it's just the fluid from the organs because
It
there's
really is all
inflammation.
intertwined.
Yeah.
Your
Sloshing
filters are
around.
Yeah.
filtering, but you have an oil leak,
Yeah.
pretty much.
Exactly.
Well, and it's in her lymph nodes
Yes.
that
Yeah.
are surrounding her
Yeah,
pancreas.
we did not mention that. There were
Yeah.
2 lymph nodes by the pancreas, very close to the pancreas that were inflamed.
Okay.
And Dr. H said, I believe that it's in your lymph nodes.
Yeah.
So it's moving around my body. So I don't know what else to say. I mean, I will say this. He said, when do you want to start? I said, next week. And he said, okay, good. That's good. You have to go to a nurse educator that's going to teach you all about this, what we're going to do and the drugs, and get the drain out. And then we'll start.
Get the drain
in.
And you've requested you'd rather have
I
a
want a
port versus IV.
Right. But I told them I'd take the first chemo through here to see how I feel about it. I don't want a port if I'm never going to have another one. But I had a port with breast cancer and I just preferred it. Messing around trying to find my veins is just a hassle. They just go boop and you just, and it's a 4-hour, right girls?
Mhm.
4 hours. He said 4 boring hours.
And when is this supposed to happen?
Well, I thought next week, but the nurse lady that called me for education on it, which I could Googled it and just read about it, but I have to go see her not till Wednesday. And so they scheduled this for the 20th of February,
My goodness.
which does not make me happy,
Yeah, that's.
but it's out of my control.
Jill, are you going to come back for that or no?
Mm-mm.
No,
No.
Deb will be here.
Okay, right.
Mhm.
So how does it, knowing for sure, because I know there was a little bit of hope there, right? For you, I know definitely. What about you? Was there some hope there that it might not, they may have misdiagnosed before they actually diagnosed for sure?
So hope is for me, the word hope, I mean, we could go down my soapbox about that word hope.
Right.
What is hope? I mean, all we have is just what's happening right here. So do I want to waste any time hoping that it's better, or do I just want to embrace where we're at right now and deal with it? And
You
that's
live more in the moment rather
correct.
than looking forward
but that's
too far.
taken me a really long time to get there.
Yeah, I've never gotten there.
Because I just feel like if I'm constantly living with what ifs and things, I get anxiety.
Right.
And so I've lots of good therapy. I've really worked hard to just be like, okay, this is what I know. And what I know is what is happening. And all I can do is just really be present and I know we got really frustrated with the doctor not calling and everything. And I just kept telling my mom on the phone, but here's the deal, Mom. He doesn't have anything to tell you. Like we don't have, he can't say, this is how we're going to treat it, because he doesn't have that. And that's out of his control. So we can get as angry and mad and spend all that energy being pissed off. But really at the end of the day,
It's wasted energy.
it's wasted energy
that you could be pouring into something
that
else,
she
right?
desperately
Sure.
needs. And so for me, the word hope, I don't know, maybe I'm very woo woo and no, when Debbie called me from the hospital that night, I was traveling, I was in Mexico, and I had my moment of reaction and crying and laying on my bed and everything, but then I'm like, all right, here we go.
So you did give yourself grace in that.
Yeah, absolutely. And I have moments.
I feel like it's important to
Correct.
literally be in your feelings and get them
Mhm.
out so that you can move on.
Mm-hmm. Mm-hmm. And my feelings, I don't want to end this podcast with me leaving town and not knowing what state Mom will be in the next time I come back, without saying that, and Debbie, correct me if I'm wrong, but I think Debbie would very much agree with me. We had
Still have.
She's right here. Like the world's best mom.
Oh.
Honest to God, like if I think about my childhood compared to what I hear that people have endured in their lifetimes, I could never be more grateful what this woman has done for Debbie and I over the last 70, or however old we are, right? And I need her to know that.
Sure.
And that whatever comes over the next 6 months, 12 months, 5 years, and we don't know really, that you have.
I'm just going to go over here and hit the tissues.
Okay. That
Thank you. Sure. And Debbie, I know those are your words.
No, I'm good. That
No,
No,
I'm good.
I'm good.
No tears come out of these eyes.
They do
when you feel like.
when I feel like it.
Yeah.
But I just need her to know that, and I know that a lot of people that love her will be watching this, and I need her to know that absolutely everything she's done as a mother has left Debbie and I with incredible memories and things that.
Do you both hope that your kids see you like you see your mom?
100%.
And do you want to try to follow in whatever footsteps she's created?
Debbie's.
I'm
Yes.
talking to you,
Yeah.
You guys. Okay. This is night. This is day.
But this has always been 9 days.
Right,
I mean, that's
sure.
just really how
And there's
Debbie.
nothing wrong with that.
Absolutely
There's
not.
nothing wrong with how you're
No,
dealing,
it's
and there's
refreshing
nothing
for
wrong with
a
how
mom.
you're dealing.
No.
You're two
Yeah.
totally different
Yeah.
people with
Mhm.
personalities that suit who you are.
Yep.
So,
Absolutely.
but
Well,
you
and I
had-
think it's important. Debbie and I are 7 years apart. So the of course, my mom was at a different life stage raising Debbie. So there were different things. Debbie and I have different biological fathers. Now, our father is our father. And we,
Sure.
We were together, the three of us, when he died of cancer 2.5 years ago. But at the end of the day, you were in a different, she's going through a divorce and having to deal with that. And my mom and dad were there, and that was, so we had different experiences. But
Yeah, they did.
Yeah, but I still had a really great childhood.
Oh.
I have nothing but good mememories.
You know,
And I know
that
that
went to Alaska.
Huh?
You
even
know
though she shipped me off.
I shipped her
Oh,
off. Yeah.
fuck, here we go. Cheers.
I'm kidding. Let's not.
No, can we do a
No.
separate podcast for that one with the therapist?
Well,
Yeah,
I
we
just.
have therapists there. for
No,
that.
but I don't look at it that way, and I've told
I
her
know you
that.
don't,
I've
but
told her
it's
that
still-
numerous times.
No,
It's-
I'm just playing with you.
I
But yeah, I mean, you've taken it a lot differently than Jill has. Like I said, nothing wrong with that. But I mean, you were hopeful,
She was.
and
She was.
I know that when you actually heard it for sure, you still didn't want to accept that.
Yeah, I didn't.
And I don't blame you, because who would want to accept that,
She
will accept it as time goes on.
She well, I don't really think she's got too much of a choice.
Yeah.
Well, that's true.
But so as far as acceptance,
I'm not there
clearly
yet.
you
I
okay,
don't think I'm there yet. I know the 5 steps because I worked with hospice.
sure.
I don't think I'm there yet because it just seems so unreal.
And I think that maybe your brain, your mind tries to protect you, right?
Yeah, I
And
think so.
because as I've always said, we're an energy. Inside of us is just energy, okay?
Mhm.
And if we allow ourselves to accept things that are inevitable, it could be that our mind's just saying, "No, you've got
Not time.
you don't
for
have
you.
no,
Yeah.
you don't have time to accept this
That's
because
right.
once you accept it, you
Yeah.
will likely just cave to it,
Yes.
and we don't want that.
No.
But at the end of the day, you're taking it and you're saying, "This is
Well,
this is
I'm
this
not-
is what I'm being told."
Obviously, I'm sitting here in a chair
Sure,
with mascara on. And
good for you, girl.
yeah, I'm just sassy.
Slay.
Sassy. I don't look sick. I mean, I think I look different. I love the bones in my neck.
Oh, yeah.
I've lost enough weight that now I see bones in my neck. But that's frivolous, I know. It's when I'm in bed and really sick. That's, I'm more accepted then. And I am in bed and really sick part of the time. I feel like I am. So,
Well, I think thus far, I mean, if anybody can hit this head on, it's you.
well, I think so.
You
I
know?
mean, I really did have that thought. Don't tell me I can't do this chemo thing. I want to
Watch me.
see.
Yeah,
Can I?
watch me.
And not even watch me. I just want to see if
Yeah.
I can.
Yeah.
So, to be continued.
To be continued.
Yes, as Rachel would say,
Right.
stay tuned.
And maybe the next time, the first time you came, this podcast, by the way, is broadcast upstairs, up a flight of stairs,
Yes, that was different.
and that
I walked.
you
up
had
those
just got
stairs.
drained the day before.
Yes.
And she did exceptional, but then a month later, it was a bit of a struggle.
I struggled getting up all those stairs. I did.
And I think that whatever timeline you're on is whatever timeline I'm on. It'll probably be after maybe your first chemo.
I think that's a good time to do it. Then I know there's some people that really want updates, and it's hard because there's a lot of people that I know and love, and I want to talk to everybody, but there's so much going on that I don't get those phone calls made.
And it's overwhelming. I mean, even though she feels very loved, and
do.
we're very gracious for everybody's, attention to this, it's overwhelming.
Yeah, sure.
So,
Yeah.
if there was a way that people could, like, if they subscribed, they would get notifications of every time every time there's a. I don't know how that works.
Right. So,
And maybe, even if mom can't, come in, maybe Debbie can come in and just give like a 15-minute update. Hey, this is what's
Sure.
going on with mom. And then that way we can get it out to people. you know?
Yeah.
sure.
Yeah.
If
That's
anybody
a
is
good idea.
anybody that's watching this that wants to follow along with the journey, go to YouTube. Stands on Air is what the channel is called, and hit subscribe. There's a little button that is next to the channel that says subscribe. And that way, anytime there is an update, you will receive the notification that there's an update. So that way you're not going,
When is it?
when is it?
Yeah.
Because we did say in the beginning, we said every Thursday.
We
But
did,
let's be real.
there was too much going on for us to-
Absolutely.
and really nothing to report, which is very frustrating.
Sure.
So to come on here and say, well,
Right. And that
all
would
those
kind of be
awful words that I use.
useless.
Yeah.
Right. It would
So
just,
yeah.
yeah.
So, but what
So
I
please
don't
like and
understand,
subscribe. Yeah, like and subscribe.
but if if this is an old person, no technology knowledge really, if they hit subscribe
Mhm.
and then they get a notice, is it going to be the podcast that you and I do? Or
It's
is
going
it
to be
gonna
whatever's
all
on
your-
that channel. It's
Okay,
gonna be
and that's
whatever's
your
on that
channel. Okay.
And it has the title. It'll show, like, I do a Monday mash
Right.
with Carl. After Natalia has her baby, we're gonna do Towel Tuesdays. So there's a lot more on there
But they
than
don't have
your
to.
journey, but they will see Liz, you know,
Mhm.
What's the name of my
Liz's
journey?
Cancer Journey.
Liz's cancer journey.
Oh,
And I named this
Oh.
episode 2.
okay.
Okay.
All right, there you go, folks.
So there's that, which is, I feel like, and I've also made you your own studio. Like through my platform here,
Yeah.
you have your own studio. Like I have Stands on Air. This is a studio dedicated just for you.
Oh, okay.
But to answer your question, yeah, they're going to get notifications weekly.
Okay, that would be good for those that are asking.
Yeah, but they can choose to go to the channel. You know what I mean?
Okay,
If it says Liz's Cancer Journey episode, whatever it is.
Okay.
You know?
okay. So there you have it, folks.
Right. And I try to, whenever this is like done and edited and downloaded and uploaded and downloaded and uploaded again, I try to tag you guys on
Mhm.
Facebook.
Yeah.
Mhm.
So,
Mhm.
yeah. And
Okay.
so we're, you know,
Okay.
everybody knows. And then
Okay.
it'll show up on your page also.
So I have told people, I'll send you the link once this, so when I send them the link, I just tell them, go to YouTube.
Mm-hmm. So
Stands on
if
Air.
you
And we
send
can
them the
put
link,
that. We can put that in the.
yeah.
Okay,
Mhm.
you'll help me.
We'll help you.
When you send the link over, it's as soon as they click that link,
That'll go
it's
there.
going to go right there.
Okay.
But so you're probably going to want to put, like
Mhm.
Jill was saying, you know, underneath the text message or however which way, email, whatever way you're sending it,
Okay.
make sure to hit subscribe.
Okay,
You
Okay.
don't even have to like. You can just subscribe and you'll get the notification.
okay, okay, good.
Yeah.
Okay. So,
So, well, for what it's worth, still stunning, still gorgeous as ever. Okay.
thank you.
And I want to thank you for again, for just being so brave and wanting to inform people about this process. I mean, that's
Yeah.
crazy brave.
If they are interested,
And
Certainly
there's a
can
lot of
be
people
along.
clearly that are interested.
well, I guess so. I hope they say that way.
Jill, thank you so much
You're
for
welcome.
joining. Deb, of course. You
Both
know.
of you,
I
yeah.
mean, you guys are amazing, and like I said, whatever way you guys decide to deal is what you do.
Mhm.
But I hope that you'll be back on, and I hope that you'll be back on.
And I would love for our kids to be able to join her. I know my daughter and son. My daughter's visiting for a few
Yeah?
weeks.
Oh,
I
yeah,
think that would
yeah.
be really cool.
Yeah,
you could have
just-
Michaela and just have it be the
You
grandkids.
know, just
Yeah,
let-
that would be really cool.
That would be
Yeah.
Just let me know.
Okay.
And what I can do also is I can, well, I mean, you always get a little nervous beforehand. You know,
Yeah, I do.
I can sit and I can guide, or I can be in the background.
And give us hand motions. Well, you noticed last time I was drinking wine. Today I'm drinking water, which
Yeah.
is pretty boring. Because he said I could drink, but it just doesn't.
Not when you're on your pain medicine.
Well, and your tummy was hurting this morning. So
Yeah, yeah.
Well, then a good Aperol spritz will take care of that.
Well,
tummy ache,
maybe I'll
girlfriend.
just taste that when we're done.
Anyway, cheers.
cheers.
Cheers
Cheers.
to you, Liz. And may your journey be
And to all of you.
longer than we all have been told.
Yeah.
Yes.
Namaste.
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 Peace, love, health, and happiness to every single person that's watching and out there. Like I said, please go to the channel on YouTube, Stands on Air is what it's called, and you can see Liz's cancer journey there, and you will get updates when it comes out. I love you guys.